The symposium, held under the theme Infertility Awareness, Access, Capacity Building and Management in Sub-Saharan Africa for Happy Families, attracted medical personnel in fertility care from all over the world. Speaking on behalf of the President, the Deputy Speaker, Jacob Olanya, told medical practitioners under the umbrella of International Federation of Fertility Societies that the President was aware that Ugandan women were affected by infertility.
There are, however, some issues that need to be fast-tracked. I am reliably informed that the field is not yet regulated. I have therefore directed the Ministry of Health to bring a bill to Parliament for a law in this regard.
Health Minister Dr. Ruth Acheng says if passed, the bill will go a long way in regulating providers of fertility services and address the cost implications involved.
Whatever is offered is determined by the provider, and the population just got to access it in their desperation. And so it is important for us to have a law that guides this practice but also regulates the practice.
We will need to emphasize issues of ethical conduct of the providers, the protection of the surrogate mothers, and the confidentiality of the beneficiaries.
Fertility care in Uganda has not been a key priority for the Ministry of Health, yet it is a fundamental right for every woman to have a child, as enshrined in the Constitution of Uganda.
So revising our health sector strategic plan to capture issues of infertility. As you heard from her very clearly, it has not been a focus in the Ministry of Health. And even when you go back in our documents, you will not find it there as an issue of concern.
The president of the International Federation of Fertility Societies, Richard Kennedy, said the organization will continue to build capacity and promote safe practices.
In infertility and reproductive health, we will do this by increasing knowledge, promoting safe practice, and improving access to care.
Although infertility affects a small percentage of Ugandans, there are grave issues that are associated with it, such as domestic violence, which need to be addressed through health reproductive campaigns.
And I always refer to this single case of a chairman of a village in my district who has married 37 women in his life. And every time he married, after 2-3 years, no child, he chases away the woman. It was during this campaign that this man woke up and said, "Oh, I didn't know the problem was with me."
About 10 to 15 of couples in Uganda cannot have children due to infertility. About 75% of these cases are due to sexually transmitted infections. Aaron Mukama, NTV.